Hi there, I'm Dr. Smee. I'm an internal medicine doctor. I'm here today to show you about how to do a feeding with an esophageal feeding tube or an E-tube, which is a feeding tube that gets placed in the side of the neck by your veterinarian. It is common to place these types of tubes in our patients that aren't eating well or taking medications, or sometimes patients that have had surgery on their mouth or jaw. So this is our patient here that's going to be helping with our demonstration. So here you can see his tube has already been placed. We placed this tube earlier today. He's wearing a product called a kitty collar. Those are collars that you can purchase online in different sizes based on the size of your pet. They're really handy. If you don't get a kitty collar, you can also have a bandage, or your vet may place a bandage. So if you look at the tube, you can see where it's sutured in, and then the tubing comes out to the end here, which is where we put the food in. So hold on, little wiggle friend. Let's see. Let's try holding them in our. Okay. So depending on how you're doing this feeding, if you're doing it at home, it might be easier. He's a little less wiggly in my lap. So you have the tubing, which you can unhook if you have the kitty collar here like this. The end of the tube, the size that you use depends on the size of syringe, and I'll show you the different syringes here. So we have a catheter tip syringe, so that's this adapter here, this longer adapter. So if you have this type of syringe, like this is a slip tip, that goes in this end. This is just water, which we flush initially first to make sure that the tube is working okay. It should flush nice and easy without any resistance. When we switch to our food, which we have here, that's going to go in this catheter tip, and then that's going to push in also, again, maybe a little more resistance than you felt with the fluid, but it should push nice and easy. So in typical feeding, this is a small amount because this is the first feeding. Your vet will give you recommendations on how much and how quickly to give the food. When you give the feeding, you're going to give it slowly over about 15 to 20 minutes. So we're just going to do a little bit here to demonstrate how that's done. Your vet may give you different recommendations, but you kind of give it slowly. If you can sit with them in your lap, that works pretty good. Sometimes I'll put a towel or a washcloth underneath this just in case any food or anything leaks out. And then if everything's going well, you want to watch their face, make sure they don't seem like they're licking too much or they seem nauseous or uncomfortable. If that happens, or if they throw up, you may want to stop the feeding and then try again later. So once we've given our feeding, and we're just going to give a little bit here, like I said, not the full amount for normal feeding, then you're going to flush.
We're just gonna give a little bit here.
Then you're going to flush the tube here with some fluid again, and you're going to see the food go through the tube, and it kind of clears out that way. So there we have that. All right, and then we're going to hook that back here just to keep it out of the way, just so that it doesn't bother him. So because he's a little fussy here, we will let him walk around here for a second while we show you some of the other parts and syringes a little bit. So when we make the food initially, your vet will help you with the recommendations. This is the food we're using for this particular kitty. We calculated out how much food we needed to mix with water, and then we figured out how many calories he needed, which is all things that if you have a feeding tube, your veterinarian will help you to do. So they will tell you how much food to feed and how often. Usually what I recommend is making up a batch of food, either putting it in a Ziploc bag or in a Tupperware container in your refrigerator. When the food is fed to your pet, because it's going in the esophagus, it's going to be the most comfortable if you give it at room temperature. So you don't want it to be cold. You also don't want to heat it in the microwave, because if you heat it up in the microwave, it's too hot. It can actually cause damage to the esophagus. So usually what I suggest is you mix it up, you put it in the refrigerator, and then when you need to use it, you can pull it up into the syringes themselves. Here's a couple of the different sizes syringes that we talked a little bit about earlier. So this is the catheter tips or the slip tip syringe with the small end, and this is the catheter tip. So that's the difference, which depends on the type of tube that you use, which one you need. Usually we use this when we're flushing the fluid. What I like to do is when I have my syringes and I first open them, I like to save these casings so that when I have my food in my syringe and I'm trying to warm it up, you can actually put it in a warm water bath in your house, and that will help keep it so it's not going to be too warm for your pet, but it's also not going to be too cold, which can also be uncomfortable. So this is a better look at the tube that we used in this patient. This is a Mila tube. It's just a different type of feeding tube. So this again is being used as an esophageal feeding tube. So it goes in the esophagus, and you can see those adapters a little bit easier with our patient that's not wiggly to see the different sizes that you can use depending on the tube adapters you have. This is also another type of tube I wanted to show that's a common tube that practices use as a feeding tube as well. It's just a different type of tube than this one, but it's also very commonly used. It's sutured in the neck the same way as the other feeding tube. This has a little Christmas tree adapter is what it's called. This can still be fed the same way as the other tube, where you hook this into this tube and give it that way. If you have the Christmas tree adapter on, there's also sometimes this little end here, and then you can also connect the tube with a slip tip syringe that way. So you can give food the same way. These tubes are more opaque, so they're a little harder to see, so you can't tell. But when you're flushing the tube, you can feel like there's more resistance when you're pushing the food, and then there's sort of a give when the water clears out the tube. That's important to clear the tube out, especially if you're giving medications as well, which your veterinarian will instruct you if medications are okay to give through the tube, because if stuff stays in the tube, then it can get clogged. Things you can try at home. So if your feeding tube gets clogged, sometimes a little bit of pineapple juice through the tube will help. The other thing that sounds a little strange is a little Coca-Cola. Sometimes that can help loosen up the food in the tube and help loosen up the clog. If it's still clogged, then I recommend you contact your veterinarian for more recommendations on how to unclog that. And I think that's everything. So thank you for watching.